Good evening and thank you so much for joining us on this episode of Family Matters. My name is Purity Museo. Bomet County reported her first case of coronavirus in May the 12th, and this was exactly 2 months after the country reported the first case of coronavirus. And since the easing of restrictions, especially on the inter-county movement in Nairobi, Mandera and Mombasa, the county has witnessed a surge of COVID-19 cases now at over 50 cases of coronavirus. So what is the level of preparedness in Bomet County? Remember, the head of state during his 8th presidential address in June this year did request every county to have at least a 300 isolation bed capacity. Has this been achieved in this particular county? And what is the level of awareness, especially among the community members right here? Speaking to us tonight is Bomet Governor Dr.Hillary Barchok. He will be telling us all this, and let's now welcome our guest tonight. Thank you so much, sir, for making time for us and for welcoming us in Bomet County.
Thank you so much, Purity, and you're welcome again.
Yes, it's barely 1 year since you took office, and there is a beehive of activities going on, especially with the pandemic. How has it been like for you? It's baptism by fire. How can you say your experience is like, especially with dealing with this pandemic, being new in the office this far?
Thank you, Purity. As you clearly indicated, I'm 1 week, 7 days old in the office. And I came in at that time when we had a number of challenges. Last year, as we started the financial year, there were challenges, disagreement between the national government, the National Assembly and the Senate about the sharing of resources and so forth. And then early this year, and we had this challenge that we are all facing, not only in Kenya, but global problem that we are facing, the corona disease challenge that we are all facing. I can't say it is baptism by fire, but to some extent I can say it is shaping me in some way, because when you are in leadership and you don't face challenges, you don't learn.
All right.
So through this challenge that I'm facing, I've learned a lot. I've learned to skills of looking for partners and friends, so that we can all handle the challenge that we are facing as a country and as a global challenge.
Yes. The country reported her first case of COVID-19 in March. 19 other counties reported their first case before Bomet County could actually say we have a case. So were you getting ready at this particular point when you were hearing that other counties outside Nairobi have started reporting cases of COVID-19, or how were you preparing before you reported your first case of COVID-19?
Thank you so much. I must say we didn't start preparing for this challenge only when we reported the case was reported in Bomet. We started earlier than that. I think it was in January when World Health Organization reported that this thing is a global pandemic. That was somewhere around 20th January. And then in February, around 20th, we put in place Bomet County Emergency Response Committee. That's a very clear indication that we started preparing early. And then, of course, as you have indicated, the first case was reported somewhere around March. And then our first case, which was actually an imported case, was reported somewhere in May, around 12.
Yeah.
Yes.
And how was the response? Because this first case that you had was actually a first case of COVID and a death. It was the first case of COVID for Bomet and a first death from COVID-19. How was this especially received to health officials here, community members here? Because I do understand there were people who were forced to go into quarantine.
Of course, I think the way we responded, even at first, we thought that this is not our problem, and that was how we received it. Until the first case was reported in Kenya, we are all living in denial that this is a Chinese thing, there's something in Europe, and so forth. So when the first case was also reported in Bomet, we faced a number of challenges. One, even the family of our late brother denied that their kin did not die of COVID-19. When the family was taken into quarantine and testing was done. Of course, we're happy that all of them turned negative. Then he was saying, no, that none of us was infected means this thing is not real, and so forth. And that is what has been happening in our communities. Most of our members in the society have been living in denial. I remember last week I was talking to some people and I was telling them it is now time that we realize this thing is real. Because even as I sit here, I can tell you of people that have died of this disease from my own village, from this community. So it is not a myth, it is a reality. And we started preparing, as I've indicated, from February this year. And there are a number of activities that and measures that we have put in place. One, of course, we have trained our frontline staff. We have also been able to train a number of volunteers, including the Red Cross volunteers. We have also sensitized the community and some of our stakeholders. We have also been able to train some of the people that we think they are working in places that they are exposed, like the officers working in the circles and my numbers in the past stages and so forth. There are also a number of things that we did even before the first case was reported. Screening in entry points to Bomet, that includes Mulot, Kunamasese, we have Jebila, and we have Taraja Sita. This screening, mandatory screening, we only stopped when the lockdown was lifted.
All right.
Because it became unmanageable. Otherwise, there are a number of things that we have put in place. We have also been producing our own masks.
And of course, we'll be getting to the capacity.
Yes.
So what is the uptake of the COVID-19 prevention protocol by your people here in terms of wearing the masks, keeping the social distancing and so forth? Have they embraced this? Are they even aware of these protocols in the first place?
Of course, human beings are human beings. And I remember it's one politician who mentioned sometimes back that Kenya ni kichwa ngumu. And we have had a number of challenges, especially when it comes to educating and sensitizing our people. First, I think a number of our people were in denial, lived in denial that this thing does not exist. Secondly, is there is this thinking and mentality that it will not be me, it will not be my neighbor. It is something that will affect maybe somebody outside this community or my neighborhood. So, and there is a lot of indiscipline, and that is why I've indicated that our success in all these measures and guidelines and strategies that we are putting in place is that uptake and discipline amongst our people. But when we move around, sometimes I go around the county, find people even after we have distributed masks. So of course we have not given masks to each and everybody, but we have done so. We are producing and distributing free of charge. Even among the people that we know we have given masks, you'll find people are not complying. And that is why we've been working closely with the national government to ensure that we ensure people comply. We have sports check, especially if we have hand washing devices, they provided in our shopping centers and markets and so forth. Are people wearing masks and wearing masks properly and so forth? So we need to do a lot of follow-up and ensure that people comply. But I can tell you for sure, people have not been doing so.
All right, let's talk about the capacity of Bomet County in terms of the isolation beds, because that has been a key concern by the national government through the Minister of Health. And there was a directive to have every county at least set aside a 300 isolation bed capacity. Where are you as a county?
Thank you so much. One, I must indicate that I have a lot of confidence in our Department of Health in terms of the measures that we have put in place to respond to this challenge that we are all facing. First, in terms of capacity building and ensuring that our health staff are well prepared and also equipped. We are not complaining about the PPEs. We receive a lot of support from the national government. We have also put in a lot of money to purchase this equipment so that our health staff are protected, because their safety comes first. Before they save lives, they must ensure that they are safe. So though we have challenges, there are challenges in terms of the resources, but we have been able to channel some of the little resources that we have to ensure that we put structures and equipment in place, so that in case of any eventuality, then we'll have the capacity to handle the cases that may arise in the county. From the model, it is projected that at a peak, we may have around 500 to 600 cases in Bomet. And there was a directive that we must have at least a facility or facilities that have a minimum of 300 beds. And as we are speaking, I can assure you that we have those facilities in place. We have set aside 4 hospitals, 2 private and 2 government institutions, where we have set aside these beds. One is our main referral hospital, where we have set aside our eye unit, where we have around 30 beds. We have Tenmek, which is a mission hospital. We have 28 beds in Tenmek. We have Kablong, which is also a mission hospital. We have around 16 beds. And we have Koyua, which is our main isolation center, where we have 226 beds. That makes around 300 beds. So I can say we are prepared and we are ready, and we have supplied beds to those facilities. We also have one major advantage in all these facilities. We have a plant that we are producing oxygen in Lokisa. The Meg Mission Hospital is also producing its own oxygen. So from statistics, and I think it was reported somewhere around last month, that 90% of our government hospitals do not have piped oxygen. And to us in Bomet, I can tell you, and I think we have witnessed, because we have been to Koyua, that we have piped oxygen. The same thing we have in these other 5 sub-county hospitals that we have in Bomet. But we have 4 main isolation centers, the largest being Koyua. So
all right.
We have made a minimum requirement of 300 beds.
Minimum requirement. And because you mentioned that the projection from experts for Bomet County is about 500 cases of COVID-19, this means that you'll not be able to accommodate all of them in different health facilities that you have. So let's talk about the home-based care program. Have you begun implementing this, and how is the uptake? Who are you using? Is it the community health workers, and have you equipped them? Because most of them are volunteers, they're not paid. So how are you engaging them as a county?
Thank you so much. Thank you so much. And I've indicated that we may have between 500 and 600. But from experts still, they are telling us 80% of all the cases are asymptomatic. So which means if we assume that there are some people who will not show signs, but they will be positive, these are the cases that should be handled in under home-based care program. And want to indicate, and they tell you and even tell the public, that even long before this thing of home-based care was mentioned by the ministry, this was part of our discussion in Bomet. We established our Bomet County Emergency Response Committee, I've told you, in PEP, and every Tuesday we normally meet to discuss the challenges that we faced over the week, and make proposals and interventions in place and so forth. And part of our discussion was how we could strengthen the home-based care. We have been able to partner with Kenya Red Cross, and we have trained a number of over 1,000 community health volunteers. In total, we have around 1,600, but we have managed to train over 1,000, and the training is still going on to empower them and give them the necessary requisite skills so that they can handle home-based care.
And there's one thing to say, that you are ensuring community health volunteers are following up on patients at home. There have been a lot of calls coming in from patients being managed at home that they are not getting any calls from health officials, especially on the follow-up when the 14 days of quarantine or self-isolation are over. There's nobody to follow up, especially on the testing. Is that a challenge for Bomet County? Because I do understand there is no testing center at this particular county.
Thank you so much. I started by saying I have a lot of confidence in my Department of Health, and they have done a lot. And compared to the region, we don't say, but talk to our people and they will be able to tell you. Our surveillance team has been very active. Our public health department has been very active, and we have been able to attend to all the cases that have been reported to us. We have a toll-free line that anyone can call at any time, 24/7, dedicated line, so you not miss to get somebody to attend to you when you are in need. It is 0800 72562. Maybe you can publish that, and then our people can get that number. This is a toll-free line you can call, and our staff will be able to attend to your cases. So far, I can say so good, because even when we take samples, it really go beyond 2 days before we get the results.
Which is, where is your testing center?
We are using regional labs. We have Kemri lab in Kericho. We have another one in Kisumu. So those are the 2 labs that we've been using. And they have been very cooperative, so we don't go beyond 2 days before we get the results, except for that time when we had a challenge with the reagents. Otherwise, they've been very cooperative, we've been supported, and I've told you, so far we have been able to test over 700 people, and out of those cases, 56 have turned positive. And we want to enhance that testing, because unless we test, then probably this thing can get out of hand. So the faster we move in testing and understanding the extent of the disease in our community, then even the measures and the mitigation that we are putting in place may not bear fruits long run. So
yes,
we must move very fast and do the testing.
And the people that are doing this job are healthcare workers. Yes. They had some time last week threatened to go on strike because some counties have not paid them, talking of substandard PPEs. Let's talk about how the county government of Bomet is engaging the healthcare professionals. Are they satisfied with the services that they are getting from the county government, even as they stay at the front line in fighting the pandemic?
Of course, our health workers, staff are also human beings, and we are describing them as front-line staff when it comes to the fight with this coronavirus. So a number of them have been exposed, not only in Bomet, but even in other counties. So far, out of the 56, 14 are our health workers who may not have necessarily have been exposed because of their place of work. Because they are also members of this community, so they can catch this disease anywhere within the community. So, but 14 of them have been affected. What we have been doing, of course, have indicated that we have trained them. We have also ensured that they have PPEs so that they can protect themselves before they save lives. But all the same, we normally say, kasi ni moyo. Na moyo pia ni kupembeleza. And there are so many ways you can pembeleza moyo ya binadamu. One of which is, of course, to appreciate what that individual is doing, and that is what we have always tried to do. Being my frontline staff, I've also been able to travel to some of these facilities, talk to them, and encourage them and tell them, though we may not be having that capacity to stand with them and work within those facilities, but they should always remember that we are praying for them and we are standing with them even as they put their lives in line to ensure that all of us are safe. So that is one. And then I also made some commitment somewhere around March that in Bomet we are going to compensate these people, not a lot of money, but something to tell them that we are thankful for what they are doing, standing and ensuring that our county is safe.
Tea farming is what this county is known for. How has COVID-19 impacted, especially on the economic activities in this county?
Now, yes, you have indicated, and I think you are right. Bomet has the largest plantation of tea in Kenya. People who want to imagine this Kericho, it is not Kericho, so it is Bomet. And though we are branding ourselves as a dairy county, we have also now a large number of animals, dairy animals in Bomet, and that is why we are branding ourselves as a dairy county. But this disease has impacted not only in our lives, or even in our livelihoods. So a number of sectors in our economy have been affected. And I'm happy to indicate to the people of Bomet and people of Kenya generally that we want to do an assessment. And we are partnering with Bomet University. We're putting some money to sponsor kind of a study that is going to assess the impact of coronavirus in the different sectors of our economy. The findings of that study will inform our decision and even the policies that we put in place to mitigate on some of these effects. So in the next 1 month, we'll be having the results of that study. It started last month, and I think it is in the tail end of it coming to finalization so that we can have the report. Otherwise, from our observation and our daily experience, a number of our sectors have been affected. Our lives have been changed, and we are not even very sure whether some of the businesses that have closed will ever come back to life. But all the same, even before we get the results of this study, we have started putting in place measures to cushion the wananchi. One is we have been able to identify over 10,000 households who are vulnerable, and we have supported those households by giving them food. Each household got 90 kg bag of maize. We had set aside around 51 million to do that exercise, and I think we'll be completing in the next 2 days the distribution of that food. We have gone through all of, the 5 sub-counties that we have in Bomet. We are also boosting what we are calling the enterprise fund. We want to establish a fund of a minimum of 100 million that this money will go to small businesses, communities, at least to assist them and give them some revolving fund. This money they will be able to borrow and return free of interest, so that at least after COVID we can still do the normal things that we used to do in terms of business. So eventually we are targeting those small businesses.
Mm-hmm.
Yeah.
And all this is coming because this pandemic, it was unexpected, so jobs have been lost and people, as you said, have been affected negatively.
Mm-hmm.
Let's wind up by talking about the challenges that the county is facing while responding to this pandemic in terms of resources, the kind of share that you're getting from the national government. Is it enough? And what, as a county, you pumping into the Ministry of Health, is it as well enough, or what is the shortcoming?
Of course, we have a number of challenges, and these challenges are not unique to Bomet. So one of which is the issue of the resources. And there is no time, just like in our homes, there is no time that we'll say you have enough money or you have enough resources. There will always be shortage. The only thing is this thing has hit us very hard, and I can say it caught us by surprise. And that is why we are channeling even resources that were meant for other programs, other projects, to the Department of Health, so that at least we can mitigate on the effects of the disease. So one challenge that we have is, of course, the resources. And when you talk of resources, it means even in terms of the facilities and the equipment that we are putting in place, we are not 100%. So because of those shortages, so we have to balance, at least have some equipment here, have some facility set up in another region, and so forth. Then the other thing is on the capacity of testing. Then I've indicated that our success in this fight, of course, one lies in the discipline of our people, and then the success of the mitigations that we are putting in place also largely depends on how fast we are moving in terms of testing and in terms of contact tracing, so that we can arrest the spread of this disease. So our capacity in testing, I think, is still a challenge, though we have come from very far. At one time, I think we were taking our samples outside the country, but at least we are now happy we have regional labs. But I think if we can move and even have a situation where each and every county will be having its own lab, the better. And then maybe our engineers should also move very fast and have technologies where you test it, just like HIV, where you take 5 minutes or 1 minute and you have the results. And that is the only way we can ensure that we move very fast and overtake the disease. Otherwise, if we are very slow, then this disease will ravage the country.
Oh, then that's a good note to end the show, calling for more testing centers, especially in every county, so that we are able to avoid the delays, especially with the results of COVID-19 patients. Thank you so much, Governor Dr. Hillary Barchok, for your time. It's been great having you on our show tonight.
Thank you.
All right, and that has been Bomet Governor Dr. Hillary Barchok speaking to us on the county preparedness and most importantly the shortcomings, saying they are prepared but they need support, especially on the labs. They need to have testing labs, and this will speed up the testing capacity to just prevent spread of COVID-19 in this particular county. Thank you once again for your time, for keeping us company here on Family Matters. I'm Purity Museo. Do enjoy the rest of our programming, and God bless.